The World Health Organization is calling for scaling up of testing and treatment of viral hepatitis. The health body warns that the disease could kill more people than malaria, tuberculosis and HIV combined by 2040 if current infection trends continue. It adds that more than 91 million Africans live with hepatitis B or C, which are the deadliest strains of the virus. The WHO scorecard looks at data from the African continent, which accounts for 70% of hepatitis B infections worldwide. Well, let's get more details on this from Ghanaian medical doctor, Dr. Hannah Lisa Tetteh. Dr. Tetteh, appreciate your time. Now, I suppose the first question would be, can you help us by understanding, in fact, help us understand what hepatitis is?
So mostly when we say hepatitis, we're speaking about an infection of the liver or an inflammation of the liver. So in simple terms, that's what hepatitis is. And there are different kinds. I know most of us just know hepatitis B or C, because those ones are the ones that we talk about a lot because they're quite deadly. But then there are other forms of hepatitis as well. There's A, there's B, then there's C, and then there's D and E as well. So that's basically what hepatitis is.
So what are the key differences between hepatitis B and hepatitis C, or those that most affect individuals?
Okay, so the key differences are the way in which they are transmitted or the way in which we get infected, and then, of course, the viruses that are causing them. So for hepatitis A and C, it's mostly through what you are eating. So fecal oral through your mouth, or when somebody who has hepatitis A or E defecates, then and gets into your mouth, then you can get hepatitis A or E. Then hepatitis B and C are mostly through what we know from mother to child, that's vector transmission or sexually transmitted. That's the commonest that we know of. And then for intravenous drug use, so if you're injecting yourself or you're using needles and blades and you're sharing those things with people, then you can get it. So the different viruses that are causing it and the ways in which they are transmitted. But the others are not so serious, and that's why we mostly focus on hepatitis B especially.
Now, I suppose the one thing that's alarming is that 91 million Africans have it, and I think this is the single largest number of any community in the world. Is this correct?
Yes, it is, but that's because Africans don't really take it serious. I mean, we're not too careful about our sexual partners. We're not too careful about sharing instruments with people. We go to the same barbering shop. We don't care whether they change the blade or whether they change the machine. The barber can use it for all of us, and we really don't mind. So I think that it's mostly because of our lifestyle. And yes, and because we don't make a lot of noise about it, Africans would like to believe that there are some things that wouldn't happen to us. And so that's why the number is large with us.
So let's talk about the main modes of transmission for hepatitis B and C in the African context. And how can these transmissions, I know you've touched on it a little bit, but how can these transmissions be prevented?
So we have sexually transmitted. So with us, you to be faithful to a faithful partner. Initially, we used to say be faithful to your partner, but then if the partner is not being faithful to you, then you have a challenge. So be faithful to a faithful partner. But if you can't be sure about that, then you should protect yourself. Use a condom. That's protective. So there's a male condom, there's a female condom. Either of you could use it as well. And then you should also make sure that before you have to use any sharp instruments, then it's new. So if you're going to the barbering shop, especially in South Africa, because we use a lot, we go to the barbering shop a lot, the men especially, and when they are done barbering somebody's hair, I don't know if it's the same in South Africa, but in Ghana, they use alcohol and you feel some pain. That's because the blade always has a way of cutting them. And so we always ask that make sure you're using new sharp instruments. Don't share them with people. Most of the time, health workers are also at risk. We get pricked a lot by needles, and sometimes health workers don't check to see if the people they were pricked by had or have hepatitis or not. And so some of these ways are the ways in which I think that we can prevent them. We just need to be careful and more vigilant and not take a lot of things for granted as we like to do in Africa.
Now, how does early detection and, I suppose, diagnosis impact the treatment outcomes for patients with hepatitis B or C?
So early detection is always very important because we give you medications, and these medications are supposed to help reduce the viral load. And so the longer you stay, the longer the viruses replicate, and they become many and many and many, and they affect your liver more. So if you come early, or if you detect it early, we give you the antiviral medication. Then you take them. It reduces the viral load. Sometimes it's very, very low or almost undetectable levels. And then it reduces the risk at which your liver gets damaged, or it slows down the damage. And that's why we keep making noise about it. But as soon as you detect, bring it to the hospital, let's make the diagnosis. And then you start your antiviral drugs. They really help in preventing long-term liver damage. And sometimes hepatitis B can lead to liver cancer. And so that's why it's very important that you come early and then we slow down the liver damage as much as we can.
Dr. Tetteh, appreciate your time on Africa Today. That was Ghanaian medical doctor, Dr. Hannah Lisa Tetteh, speaking to us about the high rate of infection of hepatitis, which is impacting 91 million people.